Hi and welcome back to another video of Medic Notes. This video will be on Alport syndrome. Alport syndrome is a genetic condition which is characterized by kidney disease, hearing loss, and eye abnormalities. And the affected individuals usually present with progressive loss of kidney function and might result in end-stage kidney failure. In 80% of the cases, Alport syndrome is due to X-linked inheritance, where the remaining cases it is due to autosomal dominant or autosomal recessive pattern. So it is due to genetic cause where there are mutations in these three genes, which are COL4A3, 4A4, and 4A5. So these genes that provide instruction to make type 4 collagen. And this type 4 collagen plays an important role in the glomeruli of the kidneys, firstly. And glomeruli are some clusters of specialized blood vessels that remove water and waste products from the blood and create urine. So in Alport syndrome, the mutations in the genes will cause abnormalities of the type 4 collagen in glomeruli, which will prevent the kidneys from properly filtering the blood. So as a result, the blood and protein will pass into the urine, and over time, the kidneys become scarred, which will lead to kidney failure. This type 4 collagen is also an important component of the organ of cortei in the ear, which helps to transform the sound waves into nerve impulses for the brain. So if there is alteration in the type 4 collagen, it will cause abnormal inner ear function, which is why there is hearing loss in some patients. Besides that, type 4 collagen also plays a role in the eye, where it helps to maintain the shape of the lens and the cells of the retina. So mutations in Alport syndrome may affect the retina and also the shape of the lens. The signs and symptoms of Alport syndrome include hematuria, where there is blood in the urine, frothy urine, where the patient noticed the urine has a lot of bubbles, which might suggest for proteinuria due to kidney disease, limb swelling due to accumulation of fluid, joint pain, hearing loss, vision loss, and also on physical examination, we can look for anterior lenticularness in the eye. I will talk about it later on. So for investigation, Alport syndrome is suspected usually based on a strong family history of Alport syndrome or kidney disease, and also based on the clinical signs of the condition. If the patient presents with signs of kidney disease and also has hearing loss and vision problems, we have to think of Alport syndrome. So the investigation that we can do is urine dipstick to check for hematuria and proteinuria. And we may order a kidney biopsy to look for signs of the condition, such as abnormalities of the glomerular cells. And it can be also done to test specifically for the presence of type 4 collagen. In a person with Alport syndrome, we expect there will be no or less type 4 collagen. So besides this, we have to do ophthalmologic examination, especially if the patient complains of vision problems. And for Alport syndrome, we expect to see anterior lenticularness, which is changes in the shape of the lens of the eye. It becomes cone shape, shown in these pictures over here. And we can also do genetic testing to confirm the diagnosis and determine the pattern of the inheritance. It can also provide information about the chance whether the other family members are affected. For treatment of Alport syndrome, ACE inhibitors, angiotensin, and statins can help to reduce the proteinuria and the progression of the kidney disease. So, however, the treatment of chronic kidney failure often becomes necessary, and this can be treated by asking the patient to modify their diet, food restriction, and also control their blood pressure. And in a lot of cases, they might progress to end-stage kidney disease, which they will require dialysis or kidney transplant. Surgical repair of the eye manifestations may be recommended. Hearing loss is likely to be permanent, but it can help them by assisting them with hearing aids. Genetic counseling may be recommended to explain to the patients the inherited pattern of the disorder. That's all for this video. Thank you.